Hey, are you suffering from a sciatica problem and you're looking for stretches and exercises and more helpful tips and information about sciatica here on YouTube? Well, my name is Dr. David Midoff and I'm a specialist physical therapist. I own a company called Paso Manual Physical Therapy. We've got a popular YouTube channel. You can just search Paso Manual Physical Therapy here on YouTube and find all our videos about sciatica problems as well as many other body parts that we help people out with. But if you're tired of looking for stretches and exercises, or if you just want some direct help from some specialists like us who know how to handle sciatica issues, then let me tell you a little bit more about the types of people with sciatica problems that we help out. Oftentimes, clients that come here in the clinic with sciatica problems are having some pain in the back of the hip, in the butt area. It's also going down into the back of the thigh many times. Often it goes all the way down into the back of the knee, the calf, sometimes even to the heel or into the foot. People usually have back pain problems, sometimes they don't. And sometimes this has been there for a while. It has come and gone over the years or months. And occasionally we get clients here that it just started all of a sudden. It's their first time. And it was either going to the hospital or coming to us in order to get treatment so they can get this problem resolved. Either way, it's terrible living with sciatica. Being able to bend forward and reach your feet, being able to pick up something from the floor is painful. In some cases, people can't straighten up all the way. They're hunched over and their back is hurting them and it's going down the leg as well. And oftentimes sleep is miserable. People aren't getting sleep. They're trying different positions, trying different pillows, mattresses. They're taking pain medications at night. Sometimes they go get injections. If they do end up going to the hospital, often they're given just muscle relaxers and painkillers, anti-inflammatory medications, and it can feel better for a time. It kind of diminishes the pain. It gets rid of the pain for a while, but then it comes roaring back eventually after a few days or at most a couple of weeks. All of this type of treatment with medications and injections is focused on the short term. There's short-term solutions. And what many people don't understand about sciatica is that if you've got it, especially if it's been coming back over and over again over weeks or months or longer, there is some deeper rooted problem in the skeleton. Usually the bones are shifted, or the muscle system as well. You can have a muscle imbalance that's shifting the bones or that's pinching on nerves. There can also be problems with the movement and posture of the individual, the way that they sit or stand or the way they walk or pick up anything that's of decent weight. And all this needs to be assessed and looked at in depth in order to get to the root of the problem. And medication and injections just don't do that. They don't solve a skeleton problem or a muscle issue or a spasm or a nerve issue as well, because sciatica is usually pain from the sciatic nerve, but it's coming from other sources typically. Now that's just a quick overview of all the different things we look at. What I want to invite you today is to apply for one of our discovery visits. This is a visit with a specialist physical therapist where we can take a look at your sciatica problem, whether in person or online virtually through a video call. If you're in person, we'll put our hands on you, check your bones, your skeleton, your muscles, check all those things that I talked about to see what is contributing to the sciatica problem. And if we're watching you through a video, then we can see how you're moving. We can use your hands to kind of help us out with feeling what's going on in your body and get a good idea for what's off on your body that's causing this sciatica problem. From that information in this discovery visit, we will figure out a diagnosis so that you can have all the best information you need to make the best health decision moving forward. And if it's right for you to work with us as a patient, then we'll recommend treatment and what that treatment plan would look like over time so that we can address the root of the problem and this sciatica problem isn't coming back over and over again, possibly leading to worse stuff like an unnecessary surgery or hurting your body some other way like your organs because of repetitive use of medications or injections as well. The clients that come and see us for their back pain problems are typically people who like to be active, like to do things around the house. Many like to exercise. Many have kids or grandkids that they love being a part of their lives and need to be active for. And sciatica has just stopped them in their tracks from being able to do all those things. Oftentimes even just working, even if it's a desk job where they're sitting, it's miserable. They can't focus because the sciatica problem is so bothersome that they can't concentrate on their work. Those are the types of people that come in and get treatment with us to solve their sciatica problem. And they truly get long-term relief, not just short-term relief or relief that comes with a bunch of side effects from muscle relaxers or pain medications where they feel like they're just tranquilized, like they can't do much else besides sleep all day. Yeah, the pain's gone, but they can't think about anything else, and they're scared to drive often because they're not thinking straight as a result of taking those pain medications. If that's you, then you need to click through this video here and fill out the form and leave us your details. We'll receive your details on our end, and one of my staff will call you back to take you through the application process for a discovery visit. And they just want to make sure not to waste your time so that we can send you to the right place in case we can't help you out. And if we can, we'll let you know the next steps so that you can get going on your discovery visit. Now, you might be skeptical. Oftentimes clients that come and see us and we're telling them, this is very fixable, this is shifted, this is weak, this is loose, whatever the case might be for that specific individual. They're kind of stunned to find out how easy it is for us to treat sciatica problems. But in case you're skeptical, go to our website, epmanualphysicaltherapy.com, or just Google Paso Manual Physical Therapy and see our testimonials. Just scroll down on our homepage and you can see real El Pasoans that are sharing their story. Many of them have had sciatica, and there's many that have had other issues, and they're telling you how we've helped them with their sciatica problem and how they've gotten back to exercise and taking care of kids and working and all the things like I shared. So you're welcome to go check that out. My biggest concern is that you wait too long and that this sciatica problem gets worse and worse and worse over time, especially if you're just throwing pain medication at it, or if you're getting injections and you've already had more than one or two, or if you're considering having some sort of surgery. Oftentimes people have disc surgeries in their lower back to treat a sciatica problem, when in reality, there might be a disc herniation, but that may not be the biggest source of nerve pain, of the sciatica pain. It might be some pelvis shift or something even in the foot. Oftentimes we'll find foot problems that can be leading into the hip, causing the sciatica problems. And if they have the surgery, it may not resolve completely because there's some other untreated issue. And that's what we look at here. Either way, at the end of your discovery visit, our goal is to have you leave our clinic here or end our telehealth call feeling like you know way more about what's going on with your specific sciatica problem so that you can make the best decision moving forward. I wish you the best of luck in your sciatica treatment. Have a wonderful day. Bye-bye.